Welcome to Creative Subconscious Podcast, episode on psychedelic integration. I'm thrilled to welcome a psychedelic therapist, Jennifer Allen, who is, among many things, is also an art therapist, psychotherapist, certified in psychedelic and research therapy, as well as a trained ketamine-assisted therapy. She's also a yoga teacher and trained in depth psychology. Jennifer facilitates workshop using her Art for Access process, among many other practices. And she has taught at Esalen Institute in California, as well as other international locations. Jennifer has actively worked with her dreams and creative process since 1980s and has been in a private psychotherapy practice and a student of earth-based traditions since 2001. She's a student and practitioner of shamanism, Indian cosmology since 2013. And Jennifer is also an author of 2 books. One of them is called Bone Knowing, a true story of coming to life in a face of impending loss, and A Cinnamon Roll Sunday, a children's story of anticipatory grief. It's a great honor to have Jennifer come in and talk to us about psychedelic therapy, her experiences, latest research, as well as harm reduction. As I have experienced over the years, clients who come in with unintegrated experiences that truly get in the way of their day-to-day life and their professional progress, these experiences can be integrated and they can be of a great benefit for growth with the right knowledge and education. So without further ado, we're going to move into the conversation with Jennifer.
Good morning. Good to be here with you.
Yeah, I'm really excited to talk to you about psychedelic therapy. This is the second time we're having this podcast conversation. The first time we did it on altered states and expressive arts therapy, which you also practice. But majority of your practice is also a psychedelic work. And I would love to learn more about what you do. Why did you get into that area of work? And anything else you wish for us to know?
Sure. Well, I'll start with that. I have practiced psychotherapy for about 30 years and a little over 20 in a private practice. And most of it, my focus has been with trauma and grief. And trauma, the whole thing about trauma is really integrating these memories, these experiences. And it's a bit overwhelming how much trauma there is out in the world. And so I'm always looking for what are ways that we can help heal this situation. And when I heard about psychedelic therapy, I kind of pushed it to the side and thought, I don't want to rely on any substances to help with that. And I could see that this was starting to emerge, this field, and little by little it piqued my interest because I felt like we need any and all hands on deck for the state of the situation with people and trauma and cumulative trauma in our world. So I went to CIIS in that first program. It was the only program at the time on the planet, I believe. The CPTR, the certification in psychedelic therapies and research. It was amazing. That was 2018. And that program has grown tremendously since, and there are so many others now. When I went to that program, I started to realize, and also with my own personal experience with a psychedelic, like, oh my goodness, there's so much I didn't know, and all the possibilities. And it opened so many doorways to the potential of how we could heal with these allied molecules and plants. So I started to educate myself and become very interested in this field. I think like a lot of people, it starts with a personal experience and then kind of blossoms from there. And currently, after I graduated that program, I also did a training in ketamine-assisted psychotherapy because currently in the United States, or at the time when I was when I completed that program, it was like all this great education and excitement. And then what do you do with it? Because you can't, because it's not legal, except for ketamine. So I got my ketamine training and started doing that work and have been doing that work ever since, both in groups and individually. And then most of my practice is either ketamine or the integration of expanded states of consciousness that people are experiencing on their own, because there's a psychedelic renaissance. There's a lot of people curious and finding access to these. And so I do harm reduction consultation and integration. And then I train clinicians to help people to integrate, because our clients are having these experiences whether we know it or not. And if we make ourselves safe and we educate ourselves and know that arena, it's very different than traditional psychotherapy. We can best support them.
Amazing. Can you talk a little bit more about harm reduction and also how is it different from regular psychotherapy?
Yeah. Well, the second part of your question is there's a big answer there. I mean, it's endlessly, but let me start with the first part. So harm reduction is a kind of a clinical way of educating people. And it's a funny phrase, because psychedelics on the harm scale are such a low on the harm scale. And ironically, the most harm, and the highest on the harm scale are two things that we culturally have condoned: alcohol and tobacco. I think tobacco's number 1 or 2. And then amongst those is the heroin and crack cocaine.
And what do you mean by harm? Like in terms of addictions and the actual, illnesses and so on. Okay.
So yes, more who dies from it, and indirectly from the substance itself, or like for instance, if you're drinking and you get in a car accident, how many people die from this directly from the toxicity of it, or from something that happens while you're on it. And also the societal harm, how much it costs society to oversee this and put people in jail, and how it breaks up families. And there's a beautiful harm scale. I have it on my PowerPoint. I wish I could tell you the source of it right now, but I don't have it off the top of my head. But it has each different color of what kind of harm. So you can really see how much of it is bodily harm versus societal harm. So I'll give you an example. Like alcohol is like probably this big on the harm scale. Psilocybin, you can hardly see the little line. And the only part of the line you can see is pink. And pink is societal harm because it's illegal. It costs the society resources in order to pursue the people that have psilocybin or are using it. And so there's not the physicality of the harm or the psychological harm. It's really because it's illegal, there's a consequence that we call harm.
Yeah. And for those who don't know what psilocybin is, could you give a quick?
So magic mushrooms, most people have probably heard that term, magic mushrooms. There are many mushrooms that are magic, and what makes them magic is psilocybin. It's something that's in them, and psilocybin becomes psychoactive as psilocin, which as soon as it touches the saliva in your mouth, the part of the molecule drops off, and it meets your digestion and your saliva, it starts to become psilocin. So the kind of going back to the harm reduction, with psilocybin, with other psychedelics like LSD, like ketamine, like MDMA, those are probably the most common ones people have heard of. If I meet with someone and they're planning to have one of these experiences on their own, I will give them information about like which psychedelic is useful for what. Like say they're really struggling with depression, and they say, I've got all this depression, but I really underneath that have, a history of PTSD, and I just need a break. I need to find something that can help me with this, and I'm going to do it, one way or the other. So my job, because I can't really encourage, what I can do is educate and give information so they can make an educated choice and create the best scenario for themselves so that they can have the best outcome and healing from it. And I think too often that these psychedelics, people are so curious right now and they go at it kind of recreationally. And it's kind of how things went sideways back in the 60s, at least in this country, where, LSD hit the streets. It wasn't meant to, and it hit the streets. And people like Timothy Leary were like all excited, kind of like I was when I first entered this field, like, oh my God, this is a game changer. And, he was an important figure in the history of psychedelics and kind of mainstreaming them. However, LSD went from being in a, clinically researched and with quite a great amount of success way back, like, 50s, 60s, late 40s. Like there was like 1,000 different papers written on LSD and research going on. And it was such positive potential. And then it hit the street and people didn't have harm reduction back then. They just it was kind of like the 60s. We had the Vietnam War and then we had psychedelics, and those were two rites of passages for young people. And this is where I'm kind of jumping off a little bit off track, which I will circle back, but this is where politics and psychedelics started to merge here. And where things got a little, science and politics don't mix, like religion and politics don't mix. Because it wasn't conducive to have people having expanded states of consciousness where they actually didn't want to kill anybody they couldn't. You can't have young people that are going into a war that has no end in sight. There aren't enough young people to send to that war if they're all peace and love. So we got to shut that show down. And so that LSD and other psychedelics were really quickly scheduled by Nixon in 1970. And in this country, I can't speak for other countries. But that was where, despite all of the scientific evidence that LSD was going to be helpful for people for mental health reasons. So now as we revisit, like this many years later, they're starting to surface again, still Schedule 1, still illegal in this country. However, people use them. They've used them all along. It doesn't stop people. So the model for licensed therapist is harm reduction. Harm reduction is the clinical term. And it's to help people get the most from the experience, knowing that they're going to do what they do. People do all sorts of different drugs and that are legal or illegal. And so to help them know how to do that in a responsible way, to know about setting and integration, and to kind of set them up so that they can have a positive experience. It's possible that when used recreationally, people kind of get freaked out by psychedelics because they've heard, somebody jumped off a building or somebody got hyponatremia at a dance rave with MDMA. These are very infrequent situations that happen. I think we have a more recent one where somebody on an airplane did something crazy. Instead, they had psilocybin the night before or 2 days before. So you get a situation like that, the media grabs onto it, and then people, oh my God, these things are so dangerous. If we only had that same, like, think about alcohol and how many things per day, how many people die per day, how many accidents and adverse situations happen with things like alcohol that we culturally condone. Not that, and I'm not saying we should do anything about alcohol. I mean, I think that everything should be legal personally, and people can make their own choices. It's just the education about that. It's just a funny double standard we have with some things that we, than with others. So I have to use the term harm reduction. I'd really rather use the term education and really setting someone up to ultimately use the full capacity of these great allies that we have.
Yeah,
So
I would love to learn also, like, what are they great for? What would you recommend? What would you not recommend? When and how? The term of expanded state of consciousness. Would you, for those who don't know, maybe explain what do you mean by that? Because it's a very powerful state, for sure, very important one.
Yes. So there are many ways to an expanded state of consciousness, like meditation practices, breath work practices, Kundalini, certain ecstatic dance. It's not always a psychedelic. Holotropic breath work, I think, is one of the best vehicles to as robust a psychedelic state or an expansive state of consciousness as any psychedelic that I know. So psychedelics are like a chemical way, like a molecular way to change things up in the brain in the same way that breath work would, or the same way that meditation would. So that it's our consensual reality is the one we all agree on. We use our senses to know what's real. We'll call that consensual reality. it's actually quite a small box of, it's a reality we all agree on. We have to in order to function in the world. We have egos that tell us we're this and this personality. This is who I am, different from who you are. We kind of need this so we drive on the correct side of the road and don't just run into each other when we drive a car, for instance. So we have these rules that we created consensual reality with. However, it's so small and compared to much bigger realities that I'm sure everyone listening to this has touched in on those through creativity, through meditation, through other ways. Even alcohol, that altered state of alcohol goes in that direction as well. I wouldn't call it necessarily an expanded state because it's a depressive, overall, but you can feel the shift of state. So when you step outside of your consensual reality, you have other perception available to you. There's much bigger realities, just like, science can tell us we only use like this much of our brain. So imagine that there are exponential realities available to us. And our gateways in our brain, the neuroscience of this and the spiritual of this kind of are starting to merge together through quantum physics and neuropsychology. So I kind of bounce between the two. I'm so excited now that we have, a field where both come together. So imagine that you have gateways in your brain. And in order to function here, we have to shut a bunch of them down in order to focus and to not be paying attention to every single thing, both within our five senses, but also our sixth, seventh, eighth, all the other ways of sensing. So we shut those down because it would be too much and overwhelming. A psychedelic opens those gateways, or an expanded state of consciousness. It expands. So our consciousness went from this box now way, 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 way out. Mm-hmm. And the really important thing to say about that is that when done recreationally, which again, I'm not saying that that's not how I work with them, because I'm working with them with an agenda to expand people's consciousness for healing of some mental illnesses, for relieving suffering. And they can also be personally great exploration of consciousness. I consider that just as valid. And recreation in that kind of have a blurred line. But what happens oftentimes when done recreationally is there's not the attention to integrating that experience. So let's say you leave consensual reality, you go way out to this expanded state. Oh my God, you didn't even know this was all possible. And then how do you then return here? And then how do you bring anything that you just learned from out there back into this? Oftentimes when it's done recreationally, it's just like, oh, we just did that for this time and it was a good time. Oh my God, it was amazing. And then we come back to this reality. We get back into the Monday morning grind of our world. And their two are very separate. And in that way, it's not utilizing the offering of, or I feel the respect of what these plant allies and molecules are offering to us. They offer so much potential for healing. Mm-hmm. And that's kind of my thing. And again,
so you help them integrate it. You help them to translate and keep whatever the insights were, whatever the growth parts, right? For that are important for that person. You help to unpack it.
Yeah. So yes. And so what I want to have happen, so this is the box of consensual reality and how I understand integration, and I am forever learning. This is an endless field. It's never done. Is that expanded state, if we can pull threads of it and bring it and weave it into this little box of reality, this little box of reality consciousness starts to get a little bigger and a little bigger, the more that we are able to integrate this expanded state in, so that eventually there's not much difference between the expanded state and what we humans agree on is consensual reality. And, more philosophically, we can see that the state of the situation with humans as a species, we need to step outside of the box, and a lot of the problems that we have going in the world and that we've created for ourselves come from that small box. And so it's really, I think, impossible to come to a new way from within the structure that created the problem. I think Albert Einstein has a quote that you have to step outside of it in order to you can't fix the problem from the same system that created it.
Yeah, no, absolutely. I actually had a conversation with somebody who a lot of fear came up of going outside of that box and never be able to come back. Do you ever encounter that?
Absolutely. And I would say, hence, there's so much. I do the front end work as well, the preparation we call harm reduction is also preparation for that. And some people shouldn't have a psychedelic. It's not for everybody. And certainly, or they need more preparation before they enter that state. It's a valid concern in that if one doesn't have ego structure, here's the irony is that we actually need a strong ego, a sense of self, to transcend the sense of self, to allow the ego to dissolve and be able to return. And if someone has a lot of fractures from trauma, for instance, it's always a tricky one for me as to, like, this is a big question I had as I was going through the program. Like, where's the line between we're helping them heal the trauma, and yet we know this substance, MDMA in particular, 3,4-methyldioxymethamphetamine, it's the primary psychedelic that's being researched for PTSD, and very effective. MAPS, Multidisciplinary Association for Psychedelic Studies, is the one doing those trials. They just finished their second part of their phase 3 and really successful results with PTSD, amazing results. And so that substance, like, when would one enter that treatment if they've got so much PTSD and they have all the symptoms really active? We want to help them. And yet we don't want them to be too they need some grounding, in a sense, some readiness to explore that. Now, that particular psychedelic is a phenylethylamine, so it's a hard opener. You can still function during it, versus something like LSD or psilocybin or 5-MeO-DMT or ketamine, where not so much. You're not going to be able to talk or want to talk most of the time. It's not relational. It's a tryptamine. So it's like we think of the typical psychedelic trip, where you're seeing things internally, sometimes externally, and you're somewhere else for a while. So even that line, kind of returning to that where does one bring out the big power tool? When is one ready for that? When they're desperate, they're suffering so much. And so I think with the MAP studies, like, they were really careful to do good screening on who they took into those studies, because they want to ensure good results as well. So they might not be working with someone who has other, like, personality issues, disorders of types, or that might be struggling with bipolar disorder, or any history. If you have, like, any schizophrenia in your history, that's not a person who should be using psychedelics. Their gateways are already too open. They do not need more gateways open. So you have to be careful and the screening to begin with, and then to the preparation work that I do with people if they're going to use that medicine is I use EMDR. I've been a practitioner of EMDR for some years, find it very helpful for integrating trauma. And so I will start doing some EMDR with them, start resourcing them so that we have a sense of how they can go into that before they go into that much larger expanded state. Even EMDR, eye movement desensitization and reprocessing, the thing that goes back and forth as you're processing. Even that, or hypnosis, which I also work with, depth hypnosis, or shamanic drum journey, all of those are expanded states of consciousness or non-ordinary states. Those two terms are used kind of interchanged, that our psyches are usually comfortable with. So they're
naturally induced.
Yeah, naturally. Yeah, and most people it's a semi-trance state. Like EMDR creates a semi-trance state. Hence, it's why it's, I think, so helpful with processing trauma, because that amygdala, the part of our brain that's the fight or flight, is just relaxed a little bit more. And that's pretty much what's happening with MDMA in particular. Not all psychedelics, but MDMA is turning the volume down on the amygdala, the part that's the fight or flight. So that imagine when you bring a trauma memory, surfacing that, which with MDMA, your hippocampus is the volume's turned up. So you can access memory, you can access full range of feelings. However, you're not in the fight or flight. So imagine if you can bring something up without going into that auto shutdown, the auto defense mechanism. It means it can be metabolized, and the whole system can metabolize it, can feel everything there was to feel about it, can think about it, can remember it. And so hence, it's like the perfect medicine for metabolizing trauma. And I really want to be clear that not all psychedelics work that way. That's the unique signature of that empathogens or phenylethylamines. They have that quality.
Yeah. A lot of big words.
Yeah.
And what I understand is that each psychedelic is useful or can be helpful for a particular issue, right? And within that, there has to be education, there has to be preparation and the actual journey, and then there has to be an integration process, right? So that they know how to bring it back into their reality and integrate the healing or the growth or the insights that are necessary for them to get into the wholeness, I guess, right? Into like sort of happy, more balanced life. Right.
Exactly. And in terms of the range of different psychedelics, there's really two primary classes, the phenylethylamines and the tryptamines. And then there's those that fit into those. And then there's this ketamine, which is this kind of stepchild of psychedelics. Even cannabis can be considered that, in that not everybody considers cannabis a psychedelic. In the program I was in, it definitely was, and there's great healing potential with it. But I think because of its used so recreationally that it's really difficult for people to separate their historical use and their orientation to it, to more of a ceremonial or healing modality. Ketamine is on a totally different receptor. So those most psychedelics are on the 5-HT2A receptor, the serotonin receptor, which people have heard of serotonin because of SSRIs, your typical antidepressant. So you can imagine that there's a big impact on mood. And so they're used for depression, most often, like psilocybin is. But then there's ketamine that is used for treatment-resistant depression when nothing works on the serotonin receptor. You've tried antidepressants, not working. Ketamine is on the glutamate receptor, and that's a whole different complex cascade of interactions that are happening in the brain with ketamine. And so it's kind of a nice, I was a little, I don't know, skeptical of it because I had an affinity toward plants and more natural things. And I've done some traveling, and I've had the opportunity to try many different plant psychedelics like ayahuasca and psilocybin and those kinds. So I had a particular preference for those because the spirit of those is so evident. And I assumed because they came from a life form, a plant, or a mycelium. However, I had to because I was only working with ketamine, because it was the thing available to me, I kind of changed my ideas about ketamine. It's a molecule, synthesized by humans. And now we're kind of after the fact learning that it actually occurs in nature as well. We just synthesized it before we understood that. We had a reverse process here than most other things. We knew them in nature and then they were synthesized. So ketamine is a whole different receptor site. It's a molecule, but I will tell you, I've seen amazing results with it. And again, it's not for everyone, but boy, if you have someone that is really wrestling with suicidal ideation, that's the go-to. I mean, I think the percentage is around the 50 percentile about that you can shift someone out of a suicidal track with ketamine. Not everybody, but a good portion, more than anything else we know. So amazing. For that,
that's incredible.
It is incredible. And not that everybody that's suicidal is going to have access to ketamine in that moment. And it's a tricky one like that. But if someone chronically wrestles with that, and a lot of times with a really dense depression, major depressive episodes, or just a chronicness of it, there's a kind of a chronic suicidal ideation that goes with that. That ketamine, like if I was consulting with someone, I might, and that was what they were reporting, I would say ketamine might be your better option here. Also, if they're on other medications like SSRIs, that might limit what, like they shouldn't have MDMA, and because they'd have to go off the SSRI to do that, and maybe that's going to be too risky for them to do. Ketamine doesn't compete on the same receptor, so that's the better choice.
Oh, incredible! All right, and would you say, is it several sessions? Would you recommend, or depends on a person and their experience?
Yeah, so different psychedelics have different protocol, and the research with the psychedelics is a pretty good reference point for how they're used. For instance, in the MAPS research studies, it's only 2 doses of or 2 sessions of MDMA. And during the session, there's the first dose, and then they have an option of a booster dose. And the sum of that is kind of also how we gauge what the right dose is for like MDMA. Like what's the right, it needs to be robust enough a dose to do the trick, and some variation in that for each person's metabolism, and not too much. So, they go between like 125 and 200 for MDMA in the research studies, and then they do it twice. And I believe there's about a month between the two. I'd have to reference the study to do that. I believe there's about a month. And so what they notice is that the positive results from a psychedelic start to happen directly after it's out of the system. So different than how other medicines work. Other medicines like an SSRI, it has to be in our system to be effective for us to feel the antidepressive effect of it. Psychedelics are just a whole nother way of thinking about it, and that it can leave the system. The experience we had while it was in our system, that's a novel experience that we will work with in the integration. However, the positive results, it doesn't have to be in your system to continue the outcome. So the positive results that they find following, even in that month before the next dose, they're already working with it, and there's already positive results regarding the PTSD symptoms. Now, interestingly enough, if you go out 6 months or even a year, the positive results keep building. So long after the psychedelic is out of the system, even if it's just 2 doses, there's benefit that continues. And I think the key element here is that in the research studies, they're really careful on the really good preparation, really good setting during. The person is held in a very safe way, tended to by 2 practitioners. There's a lot of care given to that process so that the best outcome can happen. And then there's integration follow-up, during those, after the MDMA. So they're meeting with someone for a 90-minute session, and they're going over their experience. And then they might meet with them again 2 weeks later, and then maybe it goes out a month. But for that 6 months following, they are engaged in integration, which is weaving the whole experience in over time, and the progress continues. So with MDMA, it might be just 1 or 2 times that one takes it. For psilocybin, sometimes in the research studies, it's just 1 time. And the interesting thing on the research studies, the ones that come out of UCLA and Johns Hopkins are the 2 primary ones. But they'll have a placebo that they might take a tiny little, like a microdose, and then they have the people that take the big dose. And then the chart shows, it's on my PowerPoint so I can visualize it, but I'm trying to relay it to you. They might take them, I think it's a week apart, and they're watching for anxiety and depression. And a lot of the study I'm thinking of is done with cancer patients that are terminal. So how the demoralization, how do they feel about what's their relationship to death? And the improvements in those areas for the people that take the high dose first is, of course, much higher. But over time, it continues to stay a little bit higher, at least in the 6 months that they follow that out. And my guess, or as I was hearing the people that did that research talk about it, was that they had the the robust experience from the first start. And the people that had the low dose, like they didn't quite have that. They caught up with that, or they started to catch up, but there was some lag time. It's almost like the disappointment of like, you didn't quite get the big medicine, didn't quite do the trick. And so I don't know, there's so many other factors of the psychology of that. But what I want to say about that is that the one dose had, again, growing progress over time. And with that particular study, the number one outcome was, or the thing that people said when they were interviewed after, was they lost their fear of death because they realized that death wasn't what they thought it was. So that's, in a way, how a psychedelic can show you something that, from the great mystery, that we can't ever know all of that, but we have a little glimpse into it. And once we have that glimpse, it may change our relationship to things like death.
Wow, that's incredible. That's really, yeah.
I just want to finish up with your question about how many times, because I want to say ketamine's different. Ketamine, that's the downside, is that most people that are having a treatment-resistant depression, they have to go back and have regular intramuscular doses or IV big doses. And everybody is different. It's such a new field that we don't know. Everybody, the training programs, they all have their own protocol, but ultimately it's an individual thing. And some people will have that one intramuscular shot in a clinical setting and be able to maintain themselves with lower oral doses at home. And cost-wise, that's really efficient to do that. And they can have their own experience. Then they work with their therapist on integration periodically, as they have their medicine. And that's a great, and it works. Some other people, they might have to every month come in and get be in a clinical setting and get a larger dose of ketamine, and then work with the integration of that experience. Some people can get 6 months out of it. Some people can go a year. So that's the one where you have to kind of work with a clinician to track it. And with ketamine, with all of these, I'm mostly referencing ketamine because it's the one I can work with. But the model for these, as they're going through the process of becoming medically legalized, and hopefully, legalized in all fronts, not just medically, is that there would be like a medical person, and there'd be two practitioners. And with ketamine, there's a medical provider to give the shot, because that's out of my scope of practice, and there's some medical implications. We need to have a medical person there for safety. And so with psychedelics coming forward, there's going to be a medical person, and then there's going to be practitioners. There's usually two practitioners sitting with a person, and those two practitioners would be as different as possible in order to receive the clients in the most widest way possible. So that might be gender, that might be race, that it could be many different ways that the two practitioners could be different. But mostly right now in the field, there's a huge need to have people of color in the BIPOC community and LGBTQ community represented as practitioners. Because as you can imagine, there's so much trauma in those populations. So if the clients are from those populations with trauma, we need to have them, space held for them, and the practitioner reflect their world and know something of it.
By people who understand and have similar experiences. That's incredible. And I think so many people probably listening wouldn't understand on a certain level why there need to be somebody present, a practitioner present during the process. However, I'm sure a lot of people may wonder, like, what is it that they do? Like, what it is that you do when you're there in the process with somebody as they're journeying?
Good question. Because it will look different according to the psychedelic. So as I mentioned with MDMA, the person can be interactive. And the really important thing about being a psychedelic therapist is that, it's kind of supposed to be this way in traditional therapy, but some of our models they don't promote that. But it's always client-led. We inherently trust the innate healing capacity of our clients. And that healing, the inner healer, and that's now a clinical term, the inner healer, it's acknowledged that we all have that intelligence, and that a psychedelic helps open the gateway, helps open the access to that healing intelligence. So really important, first and foremost, of the practitioner is to trust that in the client. I do not have to lead it. I don't know what is in the best interest of this client. And as they enter that state, I am watching and tracking and just learning. I'm learning as they go, and I have to be so fluid and flexible that I can meet where they need to be met. So in MDMA, that would look different. They might go inward for a long time, and then they might start talking, and they might open their eyes and want to share, like have their eye shades back up and say, oh, there's something happening now, and it's reminding me of that traumatic event, and I can feel it. And I just remembered something about that event. And so I would just be with them. And if they said, I need someone to hold my hand right, so I'll hold their hand. And I already know what the trauma is that they're going toward, because we've done that in our preparation. And so I could be with them and kind of help move that along as they go. They are going, I'm following, but I'm supporting as I follow. Now, different. Amazing. Ketamine is very different, for instance, and that's the one that I'm working with. It would look like it's a 3-hour session. The first half hour, 45 minutes that we're together, we're going over what's happening right now, what their intention is going into the experience, what they're working with. I would have met with them previously, but it might have been 2 weeks ago. It might have been 2 days ago, so that we're preparing for whatever what they're bringing to the experience, what they're hoping for. Maybe it's they're working with depression, and they have certain places in their life that it's playing out, and or their symptoms in their body. And so we kind of go over where they are and how they feel about going into the medicine. If it's their first time, they're oftentimes they're really nervous or scared, because ketamine is highly dissociative. The ego disappears really quickly. You don't know who or what you are. You may not even remember your name. You may not know what a human being is. So that's highly dissociative. And so, to lose touch with your body, you touch this in the medicine, you don't even know it's you. You can't, the sensation is not the same as being in a physical, like with our usual senses. You might feel like, right.
That can be so nerve-wracking, I imagine, for so many. Yes. Losing total control. I think that's one of the biggest fears for anyone doing psychedelic therapy.
Yes. So in preparation for that, we work with how they're feeling about that, we normalize the nervousness and kind of return to why they're doing this to begin with, what they hope to get from it. And then we're going with the medical provider over what the right dose is for them and what that looks like. They've already met with their medical provider, so they have some orientation to her. And then the medical provider administers the medicine. They put their eye shades on. They have their headphones with the music, or it's played out loud ambiently. The music playlist is another whole thing, and each psychedelic has its own arc of its the course of the medicine. And so ketamine, I happen to make a lot of ketamine playlists because I work with ketamine so much. So they have their music, and they're instructed to kind of flow, let the music take them through different experiences. If they get stuck, they allow the music to take them through, bring the focus back into the music. If they are someplace they don't want to be, they move right through it, not away from it, always through, as if a river is carrying them through the whole experience. And the river is the music. So the music is a really important part. And then they're usually with that experience for about an hour, and then they start to gradually land. And at some point, they start to look through the bottom of their eye shades, look around like, oh, I'm back in this reality. They start touching their body like, oh, I'm here. So what I'm doing while they're way out somewhere is I'm holding sacred space. And what sacred space is to me is to keep myself clear of anything that I brought. I want to be clear of anything going on in my personal world. I want to be impeccable with my energy. And so I have energy practices that I use to make sure that I'm, energy wise. Like, for instance, I'd say I'm in a bad mood. I had a fight with my husband before I came into the office, and I'm just like, oh, there's something really grating on me, or I have this thing that's pending and I'm thinking about it. My energy is, it's a real thing. Some people are super sensitive that can feel people's energy when they come into a room. And with a psychedelic, you're very porous and all those gateways are open. So even if you weren't someone who's sensitive to that, now you are. So the person holding space has to keep like a meditative presence and be very capable of putting their other stuff outside. I often use like a sage to smudge myself, and if the person's receptive to it, to them, or some spirit water to Florida water to clear the space first. Different practices that come to me out of other background paths that I have that merge really well with this field. And I'm always checking to see if the client's receptive, or if they have another way they like to do it. Maybe they want to burn a certain candle or something that helps it become a sacred space for them. If they want to open with a prayer that they have, or whatever they want to say, a mantra, or I open sacred space with the directions, however it wants to happen. We create the right setting so that we have really clean, sacred space being held during. So I am in that space with them. I'm observing them kind of with a soft gaze so that I can track what's happening. Sometimes they move, they make mudras with their hands. I write down if they start talking. The medical provider's there tracking their breath, making sure that everything's safe. And ketamine happens to be a very safe medicine. So nonetheless, we have to follow health and safety protocols. So we're just tracking those things. And then as they start to land, there's this golden time of integration right following ketamine. And I would say other psychedelics, this is true also. As the person they're in an inward place, and as they start to come back, they have things that they want to share. They want it to be known before it escapes them. So with ketamine in particular, people start to come back, yet they're slightly altered. And so I very slowly follow their lead and start the integration process. And what that looks like in the hour following ketamine is very, very different than like a regular therapy thing. I'm not asking a bunch of questions. I'm not using my clinical lens to look at them. And that, I think, is the primary difference between traditional psychotherapy and integration therapy. Or I don't even want to call it therapy. And I don't think it's limited to therapists. Integration is for all practitioners that work with people in altered states.
Absolutely agreed. Yes.
Yes. And in fact, sometimes therapists can be
in the way.
Yes, handicapped by some of the training. They'll want to look through their clinical lens so badly because they've been trained that way, and it's not the right lens for this work. And so people like body workers, chaplains, spiritual workers, people that have other arenas open to them might have an easier time with integration, because it happens, the integrative process is very much a right brain activity. So when you asked initially how I got into this, I'm also an art therapist. And so art therapy is like, or any creative modality, is the way of integration. So it's a natural venue for me, because that was the way that I was working with people prior. And I would say very similar. A lot of the current trauma theories use the body, as we understand that the body is the metabolizer. And so working within the body for integration, working in the right brain with movement, with symbol, with metaphor, with bridging that experience with, I call them semi non-ordinary states, like the creative mode, or with depth hypnosis, or EMDR, all of those. So when someone's coming out of that, I'm sorry, go ahead with your question.
No, what it reminds me of, that when we go outside of that box that you mentioned, it's a different language, it's a different domain, and it's a different reality. So coming back to translate it, this is what I've noticed in general with people when the concepts are too blurry, too far away for whichever reason, whether it was traumatic experience or whether it is something that just needed to be not seen and avoided at the time, there's almost loss of language and translation. So I do find that different approaches such as shapes, forms, movement, any expressive creative art therapeutic modalities, they actually help to translate it back into that smaller box, right? To expand it. And it's a great bridge between the languages of the cognitive mind, I would say.
Hmm.
And I remember this is something that you've discussed, also cultivating and developing different languages that we also embody, right? Different intelligences.
Absolutely, absolutely. It is so for people that are very intellectual, and really organize everything from a headspace. It can be really challenging, because they all of a sudden are exposed to that there is so many more ways of knowing than our cognitive intelligence. There's so many other intelligences going on, and culturally we don't value those yet.
Yet.
We have in the past, and we're now in this phase where this is the only one that we that we value. But I think that's changing, and it's changing because it has to. Because, like, for instance, with trauma, we realize we cannot process and metabolize and heal trauma from a headspace. It doesn't work. And so,
it's so great to hear it once again. I have clients coming in who had major traumatic experiences, and I said, well, I did talking therapy and nothing has changed, or gave a temporary relief. Because it's not in the mind. It's to access it. It's in the whole. We experience things in such multidimensional ways.
Yes.
So,
yes.
yeah.
And the other thing I wanted to note was when you said there isn't language, or it's a different language, is that one of the qualities of psychedelics is ineffability. There's no words, because the states of being, I mean, I use the word, we're having to create a new vocabulary. At least in the English language, we don't have the vocabulary for this.
Wow.
Yeah. I think kind of by design. But
can you explain the concept of it, even without a word?
Do you mean the concept of the psychedelic state?
Well, ineffable, yeah. If there's
ineffability,
no
yes.
Yeah.
So because we've left all of our known, of our consensual reality, which our language, it reflects what's known. It reflects our consensual reality. So when we leave that, we now are experiencing, I call it states of being, because it's bigger than an emotion. It's bigger than a thought. Felt sense might come close, but it's bigger than anything that we can use our five senses for. And we all of a sudden realize we have other senses available to us. Some might call it like when we say somebody's psychic, or you can relay information without speaking, or you can understand a transmission. You can understand something without it being taught to you. All of a sudden, zoop, it's right in there. Or you see a gestalt of something. Maybe you see something visually in your field, and something all comes together and you understand it without any explanation. And so all these, or you sense it in your body, and it has a meaning for you that isn't something that you could cognitively explain in a concept. So those things are so far out beyond our usual way of understanding and conceptualizing that we need to develop new language to bring them in. And the language is sometimes, verbal language is somewhat limited. Poetry is the best use of language we have, because it can speak to many different things simultaneously. The imagery is even better, because it can speak, a picture paints 1,000 words. It's like that. It's multidimensional and can speak to the multidimensional space. There are many, I was just in Australia and went to the Acme Museum, where they had it was a whole room that you went in, and it was visual, it was kinesthetic, there was like everything around you in the space, you could feel it. There were words, there were sounds, there were music. So it was a whole environment. And those kind of creative expressions, I think, are the best way to maybe express and experience those altered states. I felt like I was in an altered state going into that. And I am 100% sure that the person who created that did so inspired by an altered state.
When I was working as a curator and I would go work with artists in the studio, I would always ask them, what is your process? What do you do? Do you have any rituals that you create before you start doing the work? Because a lot of the times they would, in order to get into that altered state, the state of flow, whatever it is that they call the state of connection to the self and the outer as well. So, and I do believe, as an art historian also, I do believe that it translates into the work to the viewer, in the experience of being with the artwork afterwards. And that's the real beauty. And there's even a sense of that allows us as viewers to tap into our own flow and whatever it is that needs to be seen, hence the power of creativity.
Yeah. So that creative modalities are like even song, dance, movement. Those are self-created ceremonies, rituals. Ceremony is kind of an intimidating word for people. Sometimes they think, oh, it's a little woo-woo, or I don't know, I don't know any tradition to do a ceremony if they're not aligned with one. But ceremony is really sincerity meeting creativity, and then allowing that to be expressed in an outward way. It can take many different forms.
Just to break it down into sort of more linear structure, ceremony could be the morning coffee that you do when you wake up, right? Or a walk, maybe before you go to sleep. Those are little ceremonies in themselves, or rituals that create, and they prepare you. That coffee is preparing you for a certain day, to open up, to start. And it's not so woo-woo. It's our life is filled with them. It's just the words that we're using, and even when you talk about set and the settings in psychedelic therapy, right? There's the preparation in itself. It's that is almost ceremonial as well, or any personal growth works. There's a setting that sets it up as well, and
yes, and traditionally, like where all of the plants in particular came out of, the indigenous cultures they came out of, they use they have setting and integration inherently as part of their culture. So for instance, the Bwiti tribe in Africa that uses iboga, the whole lifetime of a young person is working up to the rite of passage that they use this plant, this root for. And they are oriented to what this thing is going to do, like all the way, the whole tribe and village is talking about that this is coming, this experience for them, and they're going to go meet with the ancestors. And when they meet with the ancestors during this medicine, their job is to bring it back for the whole village, so that they can learn like what to do next. Like maybe if they're having some trouble like with something and they need some information, it's the young person's rite of passage via this medicine to bring it all back. So there's a communal function to these experiences, and a rite of passage with them. They're held in such a ceremonial way. And then there's the ceremony itself, where everybody's participating, holding space, singing, chanting for those that are experiencing the medicine. And then the other side of that, when they come out of it, on the other side, in the days and the weeks to follow, there's probably a feast the next day, bringing them back into the fold. And then what they experienced is the tribe wants to know, the whole village wants to know, what did you learn? Who did you speak to? And so in that way, it's already integral to their culture. And so when Western culture got their hands on, psilocybin, it was one of the initial ones with Gordon Wasson in the 50s, we didn't have that component. It got brought into a culture that didn't have that. And so now it's part of things going off the rails. And so we have this opportunity with the psychedelic renaissance to do it differently. And science, because that's our way of knowing culturally right now, and not to diss that, but because science is ever expanding. For instance, quantum physics is very different than the physics we had before quantum physics, which is bridging us into more closely to where the origin of the indigenous people, the things they already knew, we are just being able to scientifically prove through things like quantum physics. Mm-hmm. So we're catching up. We're getting there. It's just taken us a while because we decided we needed to know through this. So our learning curve is quite steep. And so we have, through the scientific methodology, have setting and integration, that is our ceremony. That's the way that we can make the most, and that we've learned by watching Indigenous people use these in their way. That's how it's done. We just have a scientific way of ceremony. We use different terminology. We do it through research studies so that we can prove to everybody that this is going to be okay and that it could be helpful, and to counter all of the propaganda. So you can tell I have a little bit of a little chip on my shoulder with that, which I think a lot of people involved in psychedelic work right now do, because of the frustration of having this beautiful tool that could help so many people when done in a good way, is kind of being held back from them for really crazy reasons.
Do you think, for those people who can't maybe or don't have access to psychedelic therapy or psychedelic therapist, what would you recommend? Where would they start? How do they go about it?
Yeah, well, there's a great website called Psychedelic Support, and it's set up from a woman from MAPS, the Multidisciplinary Association for Psychedelic Study. That's another great resource. And that if you want to know what's going on with research in the field, they're a good entry point. They're mostly researching MDMA, but they're also researching other psychedelics. And Rick Doblin, who started that back in the 80s, he's been doing it a long time. And he's developed, he's kind of the entry point for that. There's a lot of other like universities and such that are doing research that are good resources for learning more, like UCLA, like Johns Hopkins. But if you're looking for, like, one of the people from MAPS is the one who created the Psychedelic Support website. And that is a great resource if you want to find a psychedelic therapist for integration or for harm reduction, to learn more. And they also offer education. So they have really amazing courses. And not all of them cost anything. There's a lot of free offerings there. And for people that need CEUs, there's some you can get for CEUs, for continuing education. So I think they're a primary resource.
Amazing. And for those people who have had an experience or about to, and maybe don't know how to, they can do it independently, prepare by themselves, or maybe they could then get support afterwards as well, or speak to someone like you to make sure that they're doing the right thing. They understand what it is they're sort of want to get out of it, maybe more consciously, and then have, even online probably, right? They can do this integration work with you to get the most of the journey. Because I just want to add that there is a huge difference between doing any work by yourself and having a qualified practitioner that you do have a connection with, that is holding that space for you. It's just, I don't know, it's not even times 10, it's, I don't know, times 50, how effective that work can be when it's held properly. And so I think that's one of the reasons why I'm actually, I invited you to speak about this, because I do think there's a lack of education in general, and there's a lot of fear, and there's a lot of misconceptions. And even though it is a psychedelic renaissance, there's still a lot of people that wouldn't know, oh, I can actually arrange an online session, right? And even with the experience that happened maybe last year, right, or 6 months ago, because it's something that can be worked on even much further in the future.
Yes, and like I have seen someone, an 80-year-old woman who was still hadn't integrated an LSD experience from 40 years earlier.
Wow.
And really good example of, and it still needed integration. There were still some pieces that, again, not the right set or setting. And it created things can go sideways. So you don't want to be in that kind of altered state and not be in a safe environment. Or have stimulus coming at you that you can't make sense of. So we integrated that experience, and those symptoms resolve. So it doesn't matter how much after. It doesn't even matter really if you remember the trip itself. It's if there's something that's disturbing in the current state, what is the nature of it? And then we work with that. So I just wanted to say also that on the psychedelic support, I believe everyone on there is a licensed therapist. If you have a trauma background and you want to go towards psychedelics, whether it's for depression or just consciousness exploration, but you know you have a trauma background and you have some symptoms of PTSD, I would highly recommend that you get a therapist that is savvy to that and savvy to psychedelics. So people that have training, there's many, many programs right now for psychedelic assisted psychotherapy. It's the trauma component that I think is key for the person who has experience in that background. If you don't have that background and you're, exploring expanded states of consciousness, I don't know that you don't need to have a licensed person, but then you need to have someone that has some training in integration and preparation, harm reduction, that has some psychedelic training. There is a vast underground. Underground is the arena of people operating in this field below the radar, outside of the legal bounds. And, kudos. I'm not saying it's bad or good. It's
it exists.
Kudos. It exists, and some people take big risks in order to do that work because they believe so strongly in the healing component of these, and they're not waiting around for them to become legalized to make them available to people. The tricky part about the underground is that there's no regulation and you don't necessarily know who you're getting. You have to ask a lot of questions and you've got to really sense you got to feel it in your own gut, whether they're a good match for you and whether they can hold the space in a clean way. And if they have enough knowledge base, and knowledge, I don't necessarily mean this. I mean, this information that I'm giving you, that's just one component, and anybody can get online and memorize some things and spit that out. So it's a much broader knowledge that I'm talking about. And so interview them and don't just jump right in, and take a little time to prepare. Anybody that wants to offer you a psychedelic without preparation is probably not someone you want to work with. So the vast underground can have some very skilled people in it and some very unskilled. So it's a crapshoot. You got to use your gut on that. The above ground, there's a lot of good resources like the website I just gave you for finding people. The one thing I want to say about regular therapy, like your regular therapist that you go to maybe on a regular basis may have no idea about psychedelics. They might even have a negative orientation to it. Like a lot of psychiatrists are still kind of coming up to speed with that. And they'll say, ketamine? No, ketamine's no, what are you doing giving my patient ketamine? And they actually need some education in order to come around to that, or any psychedelic. When I encourage, if I'm doing some harm reduction work with someone and they're seeing a psychiatrist, I said, I'd really love for you to share this with your psychiatrist. They need to know what medicines you're taking, and this is a medicine. And they're afraid to, because they're afraid of judgment, or the person will try to talk them out of it, or they'll drop them as a patient. So there's still a ways to go.
I remember you were giving on psychedelic integration, I believe, and this work, and I remember you were saying so many professionals showed up. It wasn't so much the regular audience; it was other therapists, other psychotherapists, and all these professionals that really wanted to learn more, because there's just there is no training, or there wasn't at that time as much available.
Right. So at that time, that was like 2019. So it wasn't that long ago, but there wasn't anything. And in that 5 years in between, there has been so many popping up integration trainings and psychedelic trainings. I started offering, my colleague and I started co-leading, co-facilitating clinicians and practitioners integration retreats. So they're 4 days, and it's experiential. So the people have ketamine as a non-ordinary state, and we have a medical provider. And then we also do holotropic breath work separately. And then we use semi non-ordinary states like shamanic drum journeys, like creative process. So to bridge those experiences back in, but we teach the integration through the experience of it, not so much a didactic or clinical lens. And so that people can learn. And what we realized very quickly is that there's not as many therapists as we thought, but other practitioners in other places, nurses, doctors, spiritual teacher, clergy people, coaches, body workers. And so we started welcoming them, even people from the underground that just wanted more training and integration. And integration and preparation are kind of one and the same. So in our integration retreats, we talk about that the preparation for an experience is really the integration of whatever came before it. And so we kind of think of like the Ouroboros, the snake, taking its tail. And it's an ongoing, but kind of like a spiral, so that you're never in the same place twice. But every experience you have where you step out of that box, even if it's in the dream time is an expanded state. You have a dream. You might be working with that dream and the outcome of that dream as you prepare for going into this medicine state. Mm-hmm. So the integration of that is the preparation, as well as the logistics of set and setting and safety. And then as you come out of that, what you're integrating there may be what you move into your meditation with, or your meditation practice might be part of the integration or the preparation. And so you see, it just kind of keeps working so that we're ever growing like a vine spiraling upward.
Yeah, that's incredible. Beautiful. Thank you so much. This was so rich and so impactful. And I hope it provides enough information for whoever's listening to get inspired to learn more. And if they are venturing in that way, they can either contact you, maybe go to some of your trainings, or follow the links that you recommended. Is there anything else you want to share before we head out from this session?
No, I'm really appreciative of what you're doing and making opportunities to educate people and inviting me to speak about something I really love. And I just value the work that you do in the world, Marina.
Thank you so much. It's so mutual. I'm so grateful I'm just really grateful my path has crossed with yours, because it have had a lot of great impact, I think, that I wouldn't have been able to have just on my own. So yes, well, to be continued. And for anyone who wants to learn more about Jennifer's work, there will be links in the comments, and everything that she has recommended as well. You can just go and check it out there. Thank you.